drain your bladder, we're going to put this in for surgery, whatever it's for. You're going to take this. Sometimes you use the outer bag for trash, but a lot of times I use this little thing here. But I'm going to set it up. The trash always goes at the outside. And then you're going to take this and you're going to open it. Oh, you guys probably know the answer to some of these. How do you open it? Away from you. So you're going to open it away from you so your germs don't go over it. And the first thing is your little blue thing. I just take it by the very edge because I don't have gloves or under it. And the edges that I touch go under the patient. So I got to figure out which got to just touch the very edges here. So, all right. So I don't know if you guys can see, but there's a shiny side there and a flat side there. Kind of like a diaper. What goes out on a diaper, the shiny side or the flat side? Honest answer. The shiny side that keeps it all in, right? The flat side absorbs. So shiny side goes down on the bed. Ask them to lift up and can just touch the very edges here to get it looking good. So have I contaminated anything yet? No. Okay, so the next thing I'm going to do is take my glove out, and I'm going to open it off the sterile field. So I'm not going to, this is still sterile field. I'm not going to put it like this because I'm contaminating my sterile field if I open it that way. I'm going to bring it over here and open it off the sterile field. Way to keep it open is to kind of put it over the edges there. Now remember, this is also sterile field too until you decide to contaminate it. I'm going to pick up the first one by the fold there and put it on, and then the next one under the fold and put it on. And then you have your next thing here, and this is designed to open up like this. Let me just tell you that a lot of times I don't open it completely, probably because I worked in surgery, but a lot of times when you opened it up like that and you were trying to find the area, it would come down like that. So I'm gonna kind of redo this a little bit. A lot of times I just open it up halfway like that so I can rest my hand on it and my hand will still be sterile. So you can open it up either way, like that. So now I'm going to get the catheter out. Don't let this sling around or anything because that needs to be really guarded there. So we're going to put this right here. I'm going to have that be my trash, and this is what carries like a sample of urine if you need to, but I'm not going to use that right now. So I'm going to set these things right here on the sterile field because really we don't have that space available. Remember, their feet are there, but the box would be over here somewhere. So before I start touching the patient, this little plastic thing has 3 things in it that I need to do. So one thing is open up this peroxide and pour it over the cotton balls. That's one. The next thing is get your lubrication and open it and slide it on the end of that. Okay? So it protects it. And the third thing is get your water. This is a syringe of water. Take the top off and find this little green thing right here and put it on right there. Actually, I'm going to break sterile technique because I want to show you guys something here. This is after you get it inserted into the patient. You push that, and it usually has about 8 to 10 milliliters in it, so it's going to make a big balloon. And you keep it pushed in. Otherwise, if you don't keep it pushed in, it's just going to suck back out like that. So you keep it pushed in and hold it and twist it off. And that way, after it's gone into the bladder, it allows it to stay in the bladder. Otherwise, it's just going to slide out of the bladder. Does that make sense? So when you come into DC or discontinue a catheter, you need to bring a new syringe and just take it and pull out. And weirdly enough, all of your fluid doesn't pull out within the first time when you're de-seeing it. Some might. So a little thing that tells you that it's all out is this thing right here will collapse on itself. A lot of people don't know that, and they'll end up taking it out with a little bit in, which isn't good because it swells up right here and it's harder to get out of the urethra. So back to what I was originally saying, 3 things. You put the peroxide on there, you put this on the end of the tube, and you put this on here. I've used this so much that it's not staying on very well, so I'll just pretend. Okay, so now I'm going to take these, and I'm going to open up the labia. Don't move your hands, and you're going to swab from top to bottom and go around your sterile field and drop it. Once again, from top to bottom on the outside, the side away from you, and go around your sterile field. Then the next one, the side closest to you, the side closest to you, and keep it open with your fingers here. And the last one, down the middle, and down the middle. If you move this hand now, you've contaminated it because it folds back over on itself. So keep your hand right here and keep it open. Does that make sense? Okay, so we've got rid of that. We don't need this. We can take this, and you guys, can you see that tiny hole right there? When you take it out of the lubrication, it is designed to go in that tiny hole. However, these mannequins, they won't go in that tiny, tiny hole, okay? So we're just gonna put it down here and pretend like that's the right area, okay? So you're gonna put it in, and you get a flashback of urine, which means, I'm gonna break sterile technique for a second. You should see a little urine come back in that area. Once you see that, you're going to pretend like you're advancing it about 2 to 3 inches on a female, about 7 to 9 on a male. So we're gonna put that in, and now if you'll look here, I'm gonna keep this hand here because if they cough or sneeze or something, this could come out. So I wanna keep it in there and take this hand right here and pull it over and push that fluid in. Does that make sense? Mm-hmm. Okay, now before I let go, I'm going to give a little tug to make sure it's in, and then I'm going to come over here and help disconnect this. That last little bit is a very important part of the story to not forget. Okay, so it's in, and then we need to, if you're done with the sterile stuff, you need to tape it to the side of the leg. I think that boards say tape it to the side of the leg for female, the lower abdomen for male. At least that's what they used to. They usually just tape it to the side of the leg. You take this and you open it up because it's going to drain down in here. And see this is what you hang it on. And if you will lift up the bedspread on that bed over there, I'll show you where you hang it. There's 3 little loops. If you can point them out right next to you. Go down below the purple, right in the middle. Everyone can see it because they're farther away. Lift up, right there, 3 little loops, and there's one behind it. So you can hang it on any of those little loops. Just don't hang it on the bed rail because you don't want it to go up and down. Okay. So it's hung there, we'll pretend like, and let's say it's getting full, so we need to empty it. So to empty it, you're going to take it out. You get your little cylinder, open that up, let it drain, close it back, tap it against the cylinder. I get a little alcohol prep and clean that, and then put it back in like that. You got it? Mm-hmm. It's easy, right?
Yeah.
Okay, let me just say a couple things about the catheter. Since it's so unnatural, it's going into a sphincter. It doesn't feel like it. That people are really, 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 really prone to bladder infections with these. So you can't really mess up here. You got to clean it good, and then you just have to encourage a patient after they get out of surgery to drink and drink and drink water to get that as clear as possible before they take it out. sometimes they get out of surgery and it's really bloody and stuff anyway. Just, they'll turn the IVs up, but if you encourage them to drink and drink stuff that's not, I know people will only drink what they'll drink, but if you'll say, try not to drink something that's sugary, like try to drink water or unsweet tea or something to flush that out, and it's going to help them with their, when they actually take it out, that they don't have a UTI. Tell them when they take it out just to wash that area really good, keep drinking a lot of fluid, and it's going to probably feel not normal for at least a day or two after they take it out. Any questions? Okay.